Hi, I'm Dr. Maria Darcy, and this is a presentation to give you more information about the work that I do as a certified sex therapist. I'm a licensed psychologist, and I'm also certified in sex therapy. I got my certification about 8 years ago, and since then I've been working with individuals and couples who are dealing with sexuality, sexual identity, sexual functioning, sexual health concerns. Um, Prior to getting certified in my advanced training in sex therapy, I certainly worked with people with some of those concerns. My doctoral research was on women's sexuality, and I very much enjoy doing this kind of work over the years, and believe it's very important. I think if you're dealing with sexuality, sexual identity, and sexual functioning or sexual health concerns, that you work with somebody who has additional training and expertise in that area, because it is specialized work. I'd like to tell you a little bit about the kinds of concerns I work with, both individually and in a couple's context in this area. With individuals come in for all sorts of reasons, dealing with concerns in this realm. People can come in because they're exploring their sexuality or sexual identity, and they want an environment where they can really explore that safely and comprehensively in a space that's really open and accepting, and I believe I provide that. People also come in who are dealing with particular sexual concerns, which may be people who are dealing with low desire, or people who are dealing with discomfort or anxiety or apprehension around being sexual or engaging in a sexual experience. People can come in with a history of trauma and how that's playing out in the sexual realm. People can also come in with concerns around their experience in the sexual activity. For example, people might come in with who experience pain during sexual intimacy. People might come in with concerns around sexual functioning and unhappy in terms of how fully they can participate in the sexual experience. People can also come in with questions around their kind of sexual style and wanting to understand kind of what's going on with them around that, how they feel about the kinds of needs and desires that they experience, and ways in which to navigate that in the world. All of these things I work with and enjoy working with, and certainly if you want to read on my website more the individual concerns that I work with, please feel free to do that. In terms of working with couples from a sexual kind of relational or sexual health or sexual functioning perspective, couples come in for some of the reasons that I mentioned, individuals come in with, but want to address that more in a couples context. So couples may come in with differences in desire and want to figure out how to marry their needs. Couples can come in with different needs sexually in terms of different things that they like to engage in, and want a space to figure out how to negotiate that with each other in a way that meets both their sexual needs. Couples can come in when one or other partner has difficulty in pain or difficulty with certain levels of functioning, and they want to understand how to work with that in the context of their relationship, and also just talk about how that's impacting their relationship. So I certainly work with couples around those kinds of concerns. As I said, on my website you can read more about the concerns I work with and how I work in terms of sex therapy. And I very much would invite you to call me if you need further information. My phone number is on my homepage as well as on my contact page, and I certainly have a form on this page and others that you can submit with your contact information. I'll be sure to get back to you. Thank you for taking the time to listen to this presentation. I hope it's been helpful to you. I certainly think if you want a little bit more information about me as a therapist, if you look at the presentation I have on the first page or the home page of this website, that will be helpful to you. And feel free to look at my other presentations, because I think I talk a little bit about other types of work that I do there. Often people come in with a complexity of concerns, so they may be relevant to you too. Again, I look forward to your contact should that be helpful to you, and if not, I hope that you find what you need therapeutically going forward. Again, thank you for taking the time, and take good care.